Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and I have my lovely assistant Kaylin here.
Hi.
All right, so today we wanted to answer a question, a very practical question. We had a patient ask us about this recently. She was deciding, should I do an all-on-4, and or she was going to lose a lot of teeth. Should I do a bunch of dental single implants or
Bridges.
implant bridges, right? Like all over the place on her upper jaw. Okay, so what are your quick thoughts on that?
Quick thoughts for me. Time-wise, financially, it's just easier to do an all-in-4.
Okay, right.
Better aesthetics, too.
Right. Okay. Some important points, and we'll go over some of those details. Right off the top of the head, then, if that's the case, then is there any, redeeming advantage to doing individual implants or bridges?
Redeeming qualities would just be maybe, like you said earlier, sometimes the bulk on all-in-4.
If not done properly.
If not done properly. But like I told him, we've been able to completely reduce that and not have that as a down factor to any of our patients anymore.
Right, so let's show what we're talking about. All right, let's show you this example here. This is a Crystal Ultra final prosthesis. Looks beautiful, right? It's got the imitation teeth and gums. Let's look on the underside of it. Okay, so not only do we have the teeth, but you can see we have the gums there too. So some people will complain a little bit about being able to feel some of that bulk on that aspect, right? But it's very minimal. But, we tell patients about it all the time, but that's literally the only thing that patients, if they ever complain about all-in-4, that feeling some of that bulk. Now, how do we get rid of some of that bulk, right? Because you can get more bulk than that, right, Kayla?
Yeah. Oh, yeah.
Okay, so how does that happen?
So you have your dental implants placed, and then you have these little abutments that sit on top, and then that's what your prosthesis is screwed into.
Multi-unit abutments.
Multi-unit abutments.
Right. And can you tell them a little bit about them?
They're different degrees.
Right.
So
different angles, right?
17, 30, and 45.
And also 0.
0.
Right.
Based on that, so where this is, you can take these little holes or access holes and be able to manipulate them to different angles to help reduce some of that.
Right. So basically, if you do have too much bulk, like there's too much pink on this area, and it's kind of impeding your tongue, then one of the issues that could be causing it is because you're using the wrong angle abutment. And not only just if maybe you were using a 30-degree abutment and you need to kick it back to a 17-degree, and also what angle, because they only go in at certain angles, so you see me adjust for those for that, right? So what you want to go to a clinician that basically cares about stuff like that, because if some clinicians don't care about that type of stuff, then you're going to get more bulk and you're going to wonder why.
It's going to cause lisps.
Yeah, it could, right? It definitely can. So you always want to account for some of that. So I just want to let patients know, with a real example there. All right, so I'm going to refer to my notes a little bit because this is actually a really complicated topic. Okay, so I'm going to try to dumb this down as much as possible because me, I need things dumbed down for me. I'm a simple-minded guy. All right, so again, answer the question. Tons of dental implant bridges or individual implants, or should we do an all-on-4? The only thing that the dental implant bridges can have is basically because we don't reduce any of the bone, it doesn't have any palatal at all. It's just the teeth. Okay, so that is the only advantage that it has versus all-on-4. Okay, but some of the other so what are perceived disadvantages? Okay, so we talked about this at the beginning. That's why all-on-4 is so attractive. It is dental implants and bridges, individual implants, the whole implant process typically that's not all-on-4, very time consuming. Okay. Now we're talking about months. We're talking about if you need bone grafting, oh good God, you're talking about maybe even up to a year.
You're not gonna have any teeth.
Yeah, you're gonna have to be wearing a flipper or something like that. And then also the multiple number of appointments that you're coming in. If you have teeth and then you want but they're in bad shape, and then you want to do dental implant bridges or individual implants, we can't always do immediate implants. Right? So sometimes you could do immediate implants, sometimes you can't. And also you've done thousands of surgeries with me, you've seen that teeth that are very broken down, that can be very compromising to the bone and gum, right?
It takes longer to heal.
Yeah. And also if the bone and gum isn't good, imagine a front tooth, right? If that's a very compromised bone and gum situation, the aesthetics are very hard to predict, right? So then it becomes way more technique sensitive for me to be able to do all the bone grafting and the gum grafting to make sure that you have a very ideal aesthetic result. Now, if you're 80 years old and you smile and you could barely see your teeth, then not really a big concern. If I got Kaylin, smile real wide again for me. Okay, when she smiles, I can see her teeth and her gums, okay? This is like, if she, like one of her teeth, like let's say she fell on her face and knocked out a tooth and then lost some bone and gum or whatever it is, and like, we say we can rebuild your bone, we can do socket preservation, we can do guided bone regeneration. These are the types of bone grafts we do for car accident victims or trauma, this type of stuff. But still, the predictability it's not really there, right? So then we have to really tell patients, all right, here are some of our expectations, or
Pros, cons.
Yeah, exactly. And based off of that, what should we offer as treatment? Okay, so long story short, like to be able to get you in some really good aesthetics with individual implants and bridges, the predictability factor it's a lot harder to predict. Now, because of that makes my job insanely harder. Okay, so when I'm doing some of these bone grafting, like I have to do a really, really meticulous job to make sure you have the best result. Then you have to do a good job of taking care of teeth with your post-op instructions, right? Do you need extra gum grafting? Hope not, because that's going to be more pain, more procedure, more expense, right? More time, right? So those are a bunch of extra factors that like go involved in that. And because of all that, guess what happens? And I'm doing all that bone grafting and stuff like that. When I'm placing your dental implants to you, they have to go very specific spots, or also that can also affect your aesthetics. Okay, so basically everything just became 5 times more difficult. I have to be 5 times longer. Yeah, 5 times more meticulous with everything. Now, I'm not saying that this isn't a good option. If you got $100,000 lying around, by all means, go for it. It's literally, like all on 4, I'll tell people, all on 4 is definitely awesome. It's the closest we can get towards your having your own natural teeth at a very affordable cost. Am I going to sit there and lie to you and say that it is 100% like having your own natural teeth again? It's not. No. Like maybe somebody who's been missing their teeth for a long time, like been in the dentures, and they even forgot what it's like to have their own natural teeth again, and then having all 4, oh my God, they love you. They're giving you hugs and they're just so happy with it, okay? But if I was to just take all their teeth out, just take them out and say it's going to be exactly 100% exactly like having your own natural teeth again, it's not. It really isn't. It's very, 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 very close at a very, very, very small fraction of the price, So that's what makes all for awesome, and I'm a huge advocate of it. But we're all about like full transparency here. Now, what are we talking about? You say cost, right? So I don't know, all on 4, whoever you're going to depending on type of prosthesis, like could we get anywhere from like 16,000 to 30,000, somewhere in that range? Yeah, probably.
What we see in Texas.
Right. What about for this, like the implant bridges, single units? I mean, you're talking maybe up to like $60,000, maybe $80,000 in extreme cases. So depending on who you go to, I mean, it's a lot of work. And then the other thing too about it is like at some point, are you going to get really frustrated and beat down just because of like the whole process?
Right. You also have to try with that sort of lengthy process in detail, and the amount of time and effort it takes from your surgeon to actually do it. Are they going to take that time and effort to make sure that they're doing it right?
Right.
Because it's a time-consuming, very meticulous procedure. So it's like you also have to trust the person doing it that they're going to have your best interest at heart.
Right. So I mean, just mentally be prepared of the expense, the time, the number of procedures. A lot of people may be motivated at first, but then after a while, it can wear on you. All right. So one other thing I wanted to point out, case like this for periodontal disease, when these patients are coming in with severe bone and gum loss, no way in hell would I put somebody in implant bridges like that. No, it's just not the right thing to do. The aesthetics would just like
be a nightmare.
It would be a nightmare. Yeah, the all on 4 would be way more predictable to be able to provide somebody with a beautiful smile and function and expense and all that stuff. If they had very severe periodontal disease and they were going to lose their teeth. All right, and I wanted to show you a case where this patient walked into my practice, and these are all the individual implants that she placed. She didn't have these placed at her office, and good God, I just wonder, how much money she's already spent in her mouth. But let's take a look and see what her smile looks like. All right, so this is what we see. Not too bad. I mean, you see a little bit of the metal of the abutment right there. but kind of, I mean, I could definitely make some criticisms of this, right? But overall, with her missing so many teeth, with the gingival margin symmetry, like some of that could be off, so it could be considered unaesthetic, But let's also look at her when she's just smiling. Well, the good news for her, she's in her 60s, so when she smiles, you don't see her like what we call a high smile line, so you don't see her gum levels too. So that's what is the saving grace. Now, if I got somebody like Kaylin here, and I did that to her, like, and she has a high smile line and she could see all those margins, and that would be a little bit of a difficult, issue for you. So I would say, like, when diagnosing you, I'd be like, man, you should do the all-in-4, right? But realistically, I mean, the single implants, they definitely do feel like a little bit more natural, right? So, all right, so let's talk about all-in-4. All right, so what's the biggest advantage of all-in-4?
Biggest advantage, price, time.
Price. So, okay, let's talk about price. Price is going to be 1/3 to half. Okay, like if we're talking about 60, it can literally, like a third to half, $20,000 to $30,000 per arch. What else? Time.
Okay. Aesthetics.
Yep, time. I mean, they're literally
Function.
walking out day one, take the teeth out, place the implants, and then getting the prosthesis, and it's gonna look damn good, right? I mean, people sit there and they cry over it because they just can't believe the aesthetics of that and stuff like that. So time is significantly faster, and then what else? Reduced number of appointments.
Yeah,
what
reduced number of appointments, aesthetics.
Okay.
You can have more, I feel like, control over the design, the shape, everything like that.
Yeah, you're absolutely right. I mean, like the design and aesthetics, like how do we get the gums and the teeth to look? I mean, the shapes of the teeth, you can make them more square, more ovoid, like the whiteness level, all these things very customizable. You could do that with a certain extent with the individual implants and the implant bridges.
Because when you're going to get the individual implants, you don't walk out the next day with an implant crown in your mouth. It takes time to get to that point.
Right, because we don't want to load the implants immediately.
Right. So you're going to have time where you don't have anything, like he said there. You're going to have to use a flipper, something like that, a partial denture, something to keep that place while you don't have anything there for an extended period of time. So it's not like you have teeth the next day like you would with all-in-4, which I think is a big advantage.
Right. And then also, let's see, I guess, so the only disadvantages we were talking about earlier in the video is, like, you could have a little bit of the palatal bulk.
Yeah.
Right? All right, so again, but you can compensate for the multi-unit abutment. If your clinician is meticulous and trying to take care of you, then he's going to try to get the best angle for you.
Yeah.
All right, so let's talk about if something goes wrong, right? And, again, with what we do, been practicing 11 years, the way my brain is trained, and I'm always trying to think of, like, what can go wrong. Hey, by the way, if you're still watching, which, I don't know how long this video is, 13 minutes in. Please give us a thumbs up. And then leave us a comment, follow our channel. Like, we're always trying to put
Super Bowl Sunday. Tell us who you think's going to win,
Yes, we're here filming a few hours before Super Bowl starting. So this will be our last video. Okay, so but anyways, what was I talking about here?
All-in-4.
Oh, yeah, so if anything goes wrong, what can go wrong? You can lose an implant, right? Now, the last all-on-4 implant that we've seen that has failed on a patient, she's a smoker. She'd been in all-on-4 for a year, and she would not stop smoking. She actually lost one of, like, 9 implants, okay? Can happen, so try not to smoke afterwards.
She literally went home that night after the surgery and smoked. She told us.
So after I took
she
it
was
out,
like, yeah, I didn't do it.
So after I took it out and that place another one, she went, what can you do? But anyway, she's a lovely person. I love her. She's a very sweet person, but man.
Makes the best cookies.
Yeah. So anyways, but yeah, if you were to lose an implant, if you have single implants and some implant bridges, then basically if you have an implant bridge or an individual implant, like in option number 1, the expensive option, then I got to take that tooth out. And if there's peri-implantitis in that area and there's bone loss,
could go to other implants.
that can happen, but also I have to, like, take that, and there's a good chance I have to clean out that infection, pack bone, and then wait 4 months or 5 months, place another implant, and then maybe even temporize that, and then wait another 4 or 5 months, and then put the final abutment crown or the bridge on there. Okay, so that can cause some complications, right? Okay, so what happens if that happens to an all-in-4? Okay, well, because we only have 4 implants or maybe 6 implants, maybe even up to 8, I have a lot of space on the adjacent areas to be able to place another implant.
And be able to attach that to your prosthesis, so you're not going without anything.
Exactly. So we have another option. Okay, so and even if you're in your temp period, then you can just add that to your temp. Now let's say you're in your final prosthesis, and I have a bunch of other videos talking about like all on four, like final materials, all that stuff, zirconia, crystal ultra, all these things. So I'll link that in the description below. But what we can do is like if zirconia, if we need to add another implant when you're already in zirconia, you can't do that. So you have to make a whole nother prosthesis. That's one of the biggest drawbacks of zirconia. Crystal ultra is another final option, which is this. And if you want to add another implant, you can add another implant to this. That's what makes crystal ultra, like the nanoceramic, super, super flexible. So just wanted to let you know about like what can happen if that happens. And then all right, so I just basically wanted to show you here real quick a recent patient. These are her before photos. This is the after. This is in her temps right now. She had her surgery done about, I think, like 2 months ago. So we're going to put her in her final crystal ultra nanoceramic in a few months. And that should look awesome. But, the reason I show you this is because we wouldn't have been able to get rid of this gumminess. And even if she wanted to take out all these individual implants, that would have been a big factor. And also trying to get the aesthetics right with her high smile line, excess maxilla, all these issues. We never would have been able to get that right. So all on four, just saved her a ton of money, ton of time. Looks beautiful. She's super happy about it. So
yeah, it's crazy. Like the next day you see them and you're like, look like completely different people.
Yep, we love doing these cases.
Yeah.
I mean, literally, it's like these cases are like, and we get excited, and we do so many all on fours, but there's certain cases that you get excited more about.
Because you're like, ooh, what are they gonna look like?
Exactly. So, but anyways, hopefully this information was helpful. Like if again, bottom line, sum it up is, if you were to ask me what's better, I'm actually gonna make a video about it. But my dad, over about 6 years, I spent $35,000 on his upper jaw. And he, because we didn't know that he was going to lose so many teeth, he just lost another tooth like every year because of a history of a lot of root canals and a lot of crowns in his mouth. So I'll make a video about my dad one time, and where I really wish we did an all-on-4. And even though he still needs a 4-implant bridge up top, so he's going to spend over $45,000. Well, I spent that $45,000. He didn't spend a dime. But even it was interesting talking to my dad, because he's a physician up in Northeast Ohio, and he's just still having to come in. It's been kind of taxing on him. He's like 75 years old, so he wishes looking back, that we did an all-in-4 on him too. So anyways, hopefully this information was helpful. Please, again, give us a thumbs up if you like the video, and also a follow on our channel. And if you have any questions, please feel free to leave a comment below. Thank you so much for your time. Bye.